Hi guys, I am Omran from Saudi Arabia and now a respiratory therapy student in the Philippines, and today going to share you some of my experience about my course.
Omran, when someone say respiratory therapy, what does it mean? What is respiratory therapy all about?
Respiratory therapy is all about treating and assessing patient who
Mm.
has difficulty breathing or problem with cardiopulmonary system.
Who is a respiratory therapist?
The respiratory therapist, he
Yeah.
is considered a healthcare provider who is going to treat or assess or provide the correct treatment based on the condition of the patients.
Okay, so as the name implies, respiratory, like it deals
Respiratory,
with
yeah, it's about
breathing,
breathing, yeah.
only breathing.
Yeah, it focuses on not only breathing, but it focuses in the breathing. It's to maintain the
A normal breathing.
oxygenation, yeah,
Yeah.
normal breathing and high oxygenation or the good oxygenation.
Why do you choose the course, or what inspired you to take up the course?
As for me, I think anyone who is going to take a medical course or
Yeah.
anything that related to health professional or caregiver, of course, his passion is about helping other,
People to
yeah,
care for
yeah,
people.
to
Yeah.
take care about people.
So according to you, you choose the course because you have passion
Yeah, I
in
have
caring for
passion
people.
about taking care of
People.
patient or persons.
Between adults and children, who do
Yeah.
you prefer to handle?
I don't differentiate them, but I focus on children most because they cannot
Yeah.
explain their symptoms. So
Oh,
you need to discover what is the problem with them. You should
oh,
focus on them more
more than
to,
the adults,
yeah, yeah.
because the adult can, describe
Yeah,
and say
they
what
can
the problem
describe, they
is,
can help you with the assessment.
and it will be
Unlike the
easy for
children, yeah,
you.
it will be easy.
Yeah.
But in neonate, especially neonate or the newborn, you
It's
just have to
very
go based on the result of the
the medical
test
results
and yeah,
or what the mother or the parents
yeah, yeah,
verbalize.
yeah.
Since you say that a respiratory therapist is a person that deals with the respiratory system,
System. Yeah.
so apart from that, is there any other role they play in the hospital setting?
Yes, also the to educate the patient
Oh, they
about,
educate,
yeah,
yeah,
educate the
education,
patient
yeah,
about how to take the treatment or when to seek for medical attention.
report, and also on how to take their medication if
Yeah, how to
medication
take
was
the
prescribed.
medication, the
Yeah.
correct way to take the medications.
Looking back at your first year, second year, what would you say now? Did you learn something? Did you not learn something?
Yeah,
Did
of
you
course,
regret it?
yeah.
Or
Of course, all the past year they were very helpful to let you gain the all the needed information in assessment and taking care and providing the necessary test or
yeah.
everything.
So how was your first year? Stressful because
No, I cannot say it was stressful since
uh,
it was my passion and I am the one who chose the
choose the
course.
course.
So yeah,
Yeah,
it was interesting instead of saying
it's
stressful.
stressful. Yeah,
Yeah,
because you might be discouraging some people who
yeah,
want
yeah,
to,
yeah.
you
Because
know,
it's interesting for me
yeah.
since I like it.
Is there any challenges when it comes to studying respiratory therapy?
It depends on the person himself if he has a
Yeah,
passion about the course
because
or no.
yeah. So if you have passion, no challenges. Is that what you're saying?
Yeah, the challenge will become interest.
Oh, but if you are forced
If you
to,
are forced, of course, you will
okay.
face challenges.
Oh, yeah, yeah, yeah. Is
Yeah.
there any like difficulties, like expected difficulties? Like if you want to take up respiratory therapy, if you come into any school,
Yeah.
like you must see this thing, like this
Yeah,
difficulty.
the workload, of course.
The
Yeah,
workload, yeah.
workload. There is a workload.
Yeah. Apart from the workload, any other thing?
Till now, I guess maybe you have to work under stress when you are already working in the hospital
Mm,
because there is a patient who will accept the way of treatment, and some of them you have to deal with them to accept the way of the treatment.
treatment,
Yeah,
yeah.
think this will be the difficulties.
What do you think is the most important qualities a student, a respiratory therapy student should have? Like, should the person be nice, intelligent, wicked, bad intention, good intention?
If he has a passion toward the course, he will gain all the necessary things, like
Qualities.
to be politeness and be calm.
Yeah.
Yeah.
Politeness,
Yeah,
calm.
and work under stress.
Then you work
without showing that he is under stress. Yeah.
So the person should be polite.
Control your emotion.
Yeah. Calm, as you said.
Yeah.
The person should be committed, I think.
Yeah, of course.
Committed, yeah.
Of course. It isn't the first rule.
Oh, they have rule.
Yeah.
Respiratory therapy rule.
No, your rule in life.
Okay.
Not respiratory therapy. Commitment.
Is it easy? Is it an easy course?
Yeah, it's uneasy.
For you?
For everyone who has a passion toward the course.
Okay, would you tell them that be bold and like be 100% sure that it is easy?
There is nothing 100% easy, but yeah, of course there is difficulty, but you can pass this difficulty
if you have passion.
Yeah.
Yeah. So what do you love most about the course?
What the most I like about the course is that is focusing on a respiratory system. So our main goal is to regulate the respiratory rate and the oxygenation.
Yeah.
Because this is what make person alive.
Yeah.
So we have to keep him alive.
So your main goal is the oxygen
and the respiratory system in general.
Yeah. Have you been in a situation where you wanted to quit a course? Like maybe something happened, they gave you too much activity.
No, not yet. Not yet.
You like, I hate this course, I want to quit.
No, hopefully not to face something like that.
Since you started, you have not like procrastinated about it.
No, I did not procrastinate about the course.
Is there anything you don't like about this course, respiratory therapy?
No, for me, no.
No. Okay.
But during the study, as I said, the workload, and I think the workload is in all courses. There is a workload during studies.
Yeah, even in nursing there is like much activities and nurses, but like he said, if you have passion for it,
but it is part of the course, so there is no way to skip that part.
You know, nursing, after the exam, you write board exam like NCLEX.
Yeah.
So is there any organization for?
Yeah, there is.
What's it called?
Yeah, there is the respiratory board.
Yeah.
Respiratory board.
But respiratory board exam.
Yeah.
If you were not doing respiratory therapy, what would you be doing?
I guess maybe a physical therapy or nurse.
Physical therapy. Why not nurse? Why didn't you join me?
As I said, I want to be focused on
the respiratory.
Yeah, and on something, not respiratory therapy. For example, physical therapy, they are just focusing on the physical therapy, and respiratory therapy they are just only focusing on the respiratory system and the cardiopulmonary. But in nursing, you are taking everything. Yeah.
So you just want to specialize.
Yeah, I want to be specialized.
After you graduate, what's next?
Going back home
to work.
Of course.
Have you been deployed in the hospital before? Since you started?
Yeah.
Can you share some experience with us? How was it the first day you were deployed?
Actually, it was kind of interesting to discover the equipment for us, because we are dealing with the equipment and machines that for diagnostic test and so on. So that it was somehow interesting
for you.
Yeah.
So
because that was our time to be exposed on the equipment.
Did you get to make use of the equipment?
Yeah.
And you did not feel like nervous or?
No, because we did not use the equipment on a patient, on a real patient yet. So it was
practicalized.
Practicalized, yeah.
Where do you see yourself in 10 years time or 20 years time with this
Yeah,
course.
actually, what I'm thinking after having my course and start working in the hospital, like
Mm.
for and 5 to 10 years after I gain my experience, maybe I will be shift to the educational part. Maybe.
Oh, you love to teach people.
Yeah,
Have you ever like teach?
experienced it.
Yeah.
Only about my classmates.
Oh,
Yeah.
so are you very intelligent?
It's a difficult question to be answered. No
Okay,
one can
it's
say about himself that he is intelligent.
intelligent.
Yeah.
Yeah, people will be the one to rate you.
Yeah, people
Yeah, I
will be the
understand.
one who rate me.
Would you allow your child in the future to be like you, like to be a
Of
respiratory
course,
therapist?
of course.
What if the child wants to be another thing apart from?
I will just support.
Yeah, you just approve.
Yeah,
Yeah, that's right. You'll be a
yeah.
good dad. What advice will you give to someone who inspired to study respiratory therapy?
It's not about respiratory therapy. In any course, you just follow your passion. If you
Yeah,
have a passion about respiratory therapy, then
you
come and
come.
join us. If you
Yeah,
have a passion about engineering or
you go.
IT, you just follow your passion.
Yeah, just follow your passion
Yeah,
and definitely you will achieve your
yeah,
dream.
you will achieve your dream.
Yeah. Thank you, Omran, for coming.
Welcome.
Yeah, I really appreciate your advice will help some people out there. Yeah,
Thank you.
thank you for
Thank you.
sharing your experience about the course.
Thank you.
And yeah, I will also be adding his Instagram handle in the description. You
Yeah.
can follow him on Instagram. Yeah, he's all about lifestyle, right?
Yeah,
You
yeah.
post your daily
Yeah,
lifestyle.
daily lifestyle.
So you can follow him on his Instagram handle. Check the link in the description.
Yeah.
This comes to the end of this video. Make sure you subscribe, like this video and comment. And I'll see you in my next video.